My name is Roseanne Roberson, and my health policy presentation topic is the Mission Act of 2018, a bill that not only benefits our veterans, but their families and their communities. The largest healthcare system in the United States is the Veterans Healthcare Administration. They have over 1,100 community-based outreach centers, over 172 medical centers, and other sites for care. Veteran care needs outweigh their supply of physicians. Addressing this problem has been a priority for the VHA. Mission stands for Maintaining Internal Systems and Strengthening Integrated Outside Networks. This bill was signed into law on June 6, 2018 and implemented on June 6, 2019. This act now gives the over 9 million veterans who use the VA health care the choice of receiving care from non-VA facilities and healthcare providers. The mission of the act is to create a community care program for veterans that is more effective and efficient. The act will redistribute medical personnel, specialized services, and graduate medical education to rural and underserved locations throughout the United States. This especially benefits veterans that live in rural areas. U.S. Census data show that 24% of the veterans live in rural areas compared to 19.3% that live in urban areas. Veterans that live in rural areas have a higher disease prevalence than veterans that live in urban areas. When compared, the quality of life of veterans in rural areas is lower physically and mentally. The act will lead to a greater number of physicians serving veterans in the rural areas by completing their education in those areas. The new workforce opportunities will benefit the veterans and their communities. Disadvantaged veterans living in rural areas get treatments they desperately need. Training opportunities for physicians are created, which increases the number of providers in the area. This benefits the veterans and their communities. Other benefits include peer-to-peer support for veterans, establishes mobile deployment teams for underserved and rural facilities to provide specialized and routine health care, allows VA to provide transplant procedures on a live donor, and allows VA to modernize assets and infrastructure. National budget impact has been estimated to cost approximately $46.5 billion over the fiscal years 2019 to 2023. This cost would provide $21.4 billion to the new Veterans Community Care Program, which provides care to the community. $6.7 billion would be provided for expanding the program of comprehensive assistance for family caretakers to those veterans injured or disabled during military service on or before September 11, 2011. It is projected that there would be a $5.2 billion deficit increase from 2018 to 2023. After many years of debates, collaborations, and compromises, the Mission Act was passed by Congress. The House Veterans Affairs Committee, HVAC, introduced the act in agreement with the Senate Veterans Affairs Committee. The Disabled American Veterans Organization worked closely with the HVAC and the Senate Veterans Affairs Committee to reach a compromise. A joint letter with support of 38 other veterans organizations was submitted. From my point of view, I see no ramifications in Congress supporting this act. It was time-consuming, but issues were worked out, which opened the door for the passing of the act. The major influence that shaped the Mission Act of 2018 was the lack of ease in which veterans could access health care. Improvements were made under the Mission Act of 2018 that made community care work better for veterans. Not all veterans, due to where they live, had access to the VA hospital facilities. Transportation, distance to the nearest location, not being able to get an appointment within a reasonable time frame were a few of the issues. Problems with customer service made it hard to deliver community care. The use of urgent care facilities or walk-in care facilities was not in the VA's network of providers. Now they are. Old information technology and manual processing made it impossible to give veterans the care they needed in a timely fashion. The Mission Act of 2018 improved on all of these issues.